It's Dr. Kevin Jefferson here at the Region 2 National Medical Association annual meeting in Philadelphia, Pennsylvania. I'm here with Dr. Edwin Chapman, addiction medicine specialist located in Washington, D.C. Just gave a very riveting presentation on what's going on in D.C. and what he's doing about it when it comes to addiction medicine. Dr. Chapman, just give us a little bit more about information about yourself and what you're doing down in D.C.
Yes, so I'm a 1973 graduate of Howard University College of Medicine. Next month will be my 50th anniversary celebration. I practiced internal medicine for the past 47 years in private practice, but for the past 22 years, I've actually done addiction medicine, starting as a medical director of one of the 3 methadone clinics in the District of Columbia. And I often tell people that it was there that I really learned to practice medicine because I was then faced with the not only the addiction problem, but the mental health problems, as well as the social service problems that many of our clients were experiencing. And through that, it really changed the way I approach medicine, and actually took those lessons back to my private office and began using buprenorphine in 2005 for office-based opioid treatment.
So we both practice in Washington, D.C. I've known you for quite some time now. And some of your patients I see in my podiatry office.
Right.
And they say glowing things about you and what you have done to help turn their lives around. So explain to people how the program works as far as bringing somebody in and how you get them to where they need to be.
Yeah, so about 7 or 8 years ago, well, actually longer than that, it was about 10 years ago, I was invited back to Howard University as an adjunct in the Department of Behavioral Health, even though I'm not a psychiatrist. Mm-hmm. And it was there under the leadership of Dr. William Lawson that we put together this pilot demonstration showing how telehealth would assist in providing our patients with a more comprehensive treatment approach, including psychiatry, social work, nutritional support, etc. So initially, of course, that model was not being reimbursed, but then when COVID hit, all of a sudden telehealth skyrocketed and has now become a necessity in treatment.
Yeah. One of the things you mentioned in your presentation this morning was how even though the need is increasing greatly, the number of providers, people who are trained and do what you do, is not nearly enough. What needs to be done to combat that?
Yeah, so we have 2 problems in our community. The first is a structural problem just by virtue of the fact that African Americans only account for 5.7% of physicians. And we're 13% of the population. So even from that standpoint, and then when it comes to specialty training in mental health and substance abuse, the numbers are even much smaller. And then we have payment disparities. These are very difficult patients to treat, and in many instances, the insurance companies do not provide payments that are commensurate with that effort.
Gotcha. So how are we doing as not only just a city, Washington, D.C., or this region, but nationally? We have a lot of new things that are coming over here. We have the fentanyl problem. Now we have tranq and all these other new street drugs that are coming in and making what you do harder and what we all do as healthcare providers harder. Where are we now, and what do we need to do to combat the ever-growing new challenges that we're getting in addiction medicine?
Yeah, so as was previously pointed out by the Behavioral Health Commissioner here in Philadelphia, housing is a critical component of in terms of prevention. Having an increase in homelessness is, of course, undermining all of our healthcare efforts. And under COVID, we did have access to emergency housing and hotels. We had also an extension of Medicaid in some instances, but many of those preferences are going away because the COVID emergency is ending. Mm-hmm. And so people who were being subsidized in hotels or with vouchers are being put out on the street. People are going to lose their Medicaid in many states, so that's going to exacerbate the problem.
Got you. So, Doc, I appreciate what you've done today. You have anything else you want to add before we close out?
No, I think we just need to keep fighting as an organization, and particularly Region 2 in leading the way in creating innovations. And we need to look at this as a community problem, not an individual problem, because these are our brothers and sisters and neighbors.
Yes, ma'am. Yes, sir. Thank you very much,
All right.
Ed.
Okay.
For Dr. Chapman's contact information, check it out in the description of this video. Continue to stay tuned as we continue to bring more of the podcast from Region 2 National Medical Association annual meeting. Thank you.